Good day everyone, I am Andre, your science student nurse for today, and I am here to perform and demonstrate the evaluation checklist for the eye assessment. The first thing we need to do is we need to introduce ourselves, verify our client's identity, explain to the client what we're going to do, why it's necessary, and how the client can cooperate. Good day ma'am, I am Andre, your science student nurse for today, and I am here to do your eye assessment. But before that, may I know your name please?
I'm Jessica Ocampo,
How about your age please?
22 years old.
Thank you, ma'am. Ma'am, eye assessment is necessary to check if there is any variation from normal findings on your eye.
Okay.
Ma'am, please cooperate with me during the assessment.
Okay.
Thank you, ma'am. After that, I'm now going to perform the hand hygiene and observe for other appropriate infection control procedure. After the hand hygiene, we need to assemble all our equipments and supplies. So I have here the Snellen chart, object, pair of gloves, magazines, cover cards, and of course, our pen light. We need to provide for our clients privacy and dignity also by closing the curtain and by drawing the curtain and closing the door in the room. Assessment. But before doing the assessment, we need to determine the client history of the following, like vision difficulty. Ma'am, in the past few days, do you feel dizzy or parang nanlalabo na po yung paningin nyo?
Hindi.
Ma'am, how about any eye pain, like sumasakit po yung mata nyo?
Wala.
Ma'am, how about any childhood strabismus po? Like nung bata po kayo, dalawa po yung nakikita nyo or naduduling po kayo?
Hindi.
Ma'am, how about any redness or swelling of eye, like namumula po ba palagi yung mata nyo or nagluluha po ba?
Sometimes nangangati.
Noted, ma'am. Ma'am, how about any wearing of eyeglasses or contact lenses po?
Wala.
Ma'am, how about any excessive or lack of tearing, like madalas po ba tumutulo na lang po yung luha sa mata nyo or kapag umiyak po ba kayo, wala pong luhang tumutulo?
Wala.
Thank you, ma'am. For the client's eyelashes and eyelids, we're going to inspect for position, appearance, and eye blinking. For the eyelids or the eye margin, it should be moist and pink. For the eyelashes, they must be evenly spaced and they must be curved outward. The lower lashes are shorter, while the upper lashes are 2 millimeter. And for the eye blinking, it should be 15 blinks per minute. Client's conjunctiva and sclera for clarity and appearance. Using our thumb and index finger, we're going to pull down the client's conjunctiva. And we're going to ask the client to move her eye up and down, side by side. For the bulbar conjunctiva, it should be clear with tiny vessels and it should be visible. For the palpebral conjunctiva, it should be pink with no discharge. For the sclera, it should be blue-white. We're now going to inspect for the client's sclera using an oblique lighting for appearance. So I have here a pen light. We're going to inspect for transparency, smoothness, and moist. We're going to serve for the client's iris and pupil. We're going to serve for the shape, equality, and color. It should be round, equal, and has a uniform color. Inspect for client's lens. For clarity, it should be clear. Going to inspect for the lacrimal apparatus for appearance and when pressure is applied at the nasal side on the lower orbital rim. The puncta should be, or the mucosa should be pink. There must be no presence of tenderness and discharge when pressure is applied. We're now going to check the client's visual acuity using the Snellen chart and a cover card. Assume that the client is 20 feet away from the Snellen chart because this is a 20/20 visual check. So we're going to ask the client to cover her one eye with the cover card. Ma'am, please cover your OT or your oculus dexter or your right eye. And please read the letters that I'm going to point using this pen.
B, B, C, E.
Okay, ma'am, please cover your other eye or your OS or your oculus sinister or your left eye. And please read the letters that I'm going to point again.
C, F, E.
So thank you, ma'am. To check the client's near vision using a magazine and a cover card, we're going to ask the client to cover one of her eye, and with what's written in the magazine is placed 14 inches away from the client's head. Ma'am, please cover your OD or your oculus dexter or your right eye and read what's written in the magazine.
Earth has been made a place of worship and source of purification for me.
Ma'am, please cover your other eye or your oculus sinister or your left eye and read what's written on the magazine again.
Earth has been made a place of worship and source of purification for me.
Thank you, ma'am. Check the client's peripheral vision using an object and a cover card. We're going to stand 2 to 3 feet away from our client and cover one of our eye. And ma'am, please say now as I pass or as I move this pen. Please cover your left eye. Now. Now. Please cover your other eye, your right eye. You say now.
Now.
Next accommodation. We're going to ask the client to stare at the object. So I have an object here. The object is placed 3 to 4 feet away from our client. We're going to move the object towards the client's nose. The pupil must be convergent and straight as we move the object towards the client's nose, and the pupil is uniform. So ma'am, please stare at the object. I am going to move it towards your nose. Extraocular movement. So I have an object here. We're going to ask the client to follow the object as you move it in 6 cardinal signs. Ma'am, please stare at this pen. I am going to move it in 6 cardinal signs, so please follow it. The client eye must be smooth and well coordinated in all directions for the client's response to light. So, ma'am, please stare at the object there. We're going to move the pen until it's reached the client's midline. The reflection of light, we're going to note for the reflection of light at the same location of the both eye. For the direct pupil response, so we're going to ask the client to stare at the object there. We're going to move the pen at the client's side. Ma'am, please observe, please stare at the object right there. We're going to take note for the constriction of the pupil. We're going to check for the consensual pupil response. We're going to ask the client to stare at the object again, and we're going to move the pen light at the client's side. Ma'am, please stare at the object right here again. We're going to take note for the opposite constriction, for the opposite simultaneously constriction of the pupil. We're now going to check for any abnormal eye movement using the covered and uncovered text. we're going to ask the client to stare at the object right there and cover one of her eye. Ma'am, please stare at the object right there and please cover your OD or your oculus dexter. We're going to observe for any unnecessary eye movement of the uncovered eye. Please cover your OS, ma'am. After that, we're now going to document all our findings for verification.